Right, Paul, so I thought we'd talk about carpal tunnel, trigger finger, and tendinitis in the hand a little bit. We've seen
Mhm.
quite a lot of that, haven't we?
Yeah.
Yeah, so essentially, let me just explain first of all what carpal tunnel is and why all these three conditions are pretty much part of the same thing. So the flexor tendons in musicians are really important. They're powerful, and they're the things that bring your fingers down into this position. And they run, there are two tendons to each finger, and one to the thumb, one to the far joint, and one to the near joint. And they both come down through here. And then the thumb single tendon comes down through here as well. And this is the carpal tunnel down here, just between these bones you can feel over here and these bones over here. The bones are in sort of C shape like that with a ligament across the top. And all of the 9 tendons go through the middle, and then the median nerve comes through the middle of that. And if those tendons get swollen, then they squash the median nerve, give you tingling in these 3 fingers and half of that one. Sometimes it feels like it's the whole hand. And then there's a general feeling of congestion. So often these patients wake up in the morning or in the middle of the night with symptoms, because that's when the tendons tend to swell mostly, and it squashes the nerve. And then you squeeze your hands a little bit and it squeezes the juice out of the tendons. They're like sponges. And then there's more room becomes available for the nerve again, and it sort of recovers. And people naturally do that in the middle of the night or in the morning and get their movement back. But yes, so swollen tendons that can then lead to pain in the hand, generalized stiffness, sometimes coming up into the forearm, and triggering, which is another condition we've seen a lot of, where the finger suddenly flips like this. And grade 1 triggering is when it just flips like that, and grade 2 is when it sticks and you have to have your other hand to pull it out, and grade 3 is when it gets stuck so badly you can't actually pull it back, and neither you nor the surgeon can get it to come out straight again. And the good thing is that all of those, that if they happen really badly, you can give a steroid injection and that'll sort of take the worst of it away and help the condition. And trigger finger responds really well to steroid injections, but carpal tunnel syndrome tends to be a little bit more refractory than that. It's a bit more difficult. And of course, we've talked about this before, Paul, haven't we? That when somebody playing the guitar flexes their wrist a lot, they're actually reducing the volume of the carpal tunnel by a significant percentage. And so it squashes the median nerve quite a lot. So we've talked about like bar chords and low positions like that. So yes, tendinitis really common in guitarists, trigger finger very common, and carpal tunnel is really common as well. And we've seen all of those, haven't we?
Yes, we have. And I mean, when I'm working with the guitarist on those issues, and we are talking about for a right-handed player, we are talking about the left hand technique here, the hand that comes up and works on the fretboard. And I always try and emulate what my wrist would be like if I'm out walking, where it just would be hanging down. That is, of course, not possible 100% when you play the guitar, but the closer you can get to have that kind of wrist position, the more likely you are to avoid any kind of pain and the condition you're talking about. And secondly, and this is the most important thing, it's the role of the thumb, because the natural tendency is to grab. You know, you put on and you grab around the fretboard, but the fretboard, as you can see behind me, is made out of wood and it's very hard. So I use the larger muscles, you know, from the back, from the shoulder and the arm to move around on the fretboard. And the role of the thumb in general is that of a shadow. My thumb does very little. It just rests nicely behind the neck. It's
Yeah,
only when I play electric guitar, bending strings.
yeah.
Obviously, the thumb will have an active role because otherwise you can't bend the strings properly.
Okay.
After you've been bending the strings, come back to a more neutral position, relaxed position with the thumb, and I release the thumb constantly. So on the fretboard, I move around by jumping on the fretboard from fret position to fret position
Yeah.
instead of sliding where you're attached with the thumb. And it's a far better way of playing.
And I see people in a range of positions playing guitar. Some people use the thumb over position to on the lower strings, and some people will have a very low neck position, a long strap, standing up, playing with a deeply flexed wrist, and that sort of thing. We've discussed those sort of things before, haven't we?
Yeah, and I always suggest that if that's causing lack of freedom and pain, you should certainly not do it. I wouldn't recommend it to anyone to play with that kind of technique, particularly the one with the thumb up playing bass notes, the sixth string.
Yeah.
It's a technique that I personally certainly would never use.
Right. Yeah. 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 And I was very impressed with the elegance, the gentleness with which you demonstrated to some of our patients, how gentle you are with the thumb at the back of the neck, and you turned it around so we could actually see how gently you were pressing with that. And some, is it true that when you're you're doing bar chords, in order to get a good timbre to stop fret buzz, you do need to press quite hard sometimes.
That's a very good question. The technique I use on bar chords, whether it's playing classic guitar, electric guitar, doesn't matter, is that I think about gravity. So I think about my arm hanging down with gravity instead of pulling in on the instrument and the neck. And that helps me a lot, and it saves energy. But of course, the thumb is a little bit more involved in bar chords. It has to be. But then again, between the bar chords, release the thumb.
I see. Yeah, get a rest. Yeah, that's a technique that I've seen you talking to patients a lot about, which is releasing a lot to get some rest. Yeah, you found that really helpful, didn't you?
I find it enormously helpful because, let's say you were doing hundreds of movements in a piece of music. If you always attach intention to the instrument, that's going to stop freedom of movement and eventually end in pain.
Yeah. And we've talked a lot about having rest, haven't we? And after 10 minutes or 20 minutes at the most, taking some time to relax and stretch. And BAPM are quite keen to encourage people to do that when they're practicing as well, because it's very easy when you're a musician and you're obsessed with something that 30 minutes, 40 minutes will pass very easily, and you still haven't moved position. You're crouched up, focusing on it.
Exactly. You get so focused on your music that you actually forget that you have a body.
Yeah. Yes.
And how important that is when you're playing an instrument.
Yes, I've seen people do that. Yeah. Indeed. So yeah, those are some of the common workarounds we found for carpal tunnel and trigger finger, and just basically reducing the amount of load on the flexor tendons. And it's all of that stuff that brings on carpal tunnel. I only see carpal tunnel syndrome in people with busy hands. I see it in typists. I see it in carpenters. I see it in people with musicians a lot. But they're busy hands, people working hard. And actually, I think we talked about this before, tendons tend to fail when they do things that they're not accustomed to. So people often find that this condition comes on when there's a step change in the amount that they're doing. So if it's somebody who was at school and then they go to a conservatoire and they've gone from 2 hours a day of practice to 6 hours a day of practice, they'll get a tendinitis. Or if they've got a new guitar with a heavy action, then there's something that can be done to work around that. These sort of step changes, or particularly learning a new concerto or something that means that they work particularly hard with deadlines coming up. Exams are a big thing that bring on a lot of symptoms because people work much harder than they used to.
Yeah, that's absolutely true. All of that can contribute to developing these kind of condition and cause pain and stress and fatigue and anxiety.
Yeah, but it's good to know that there are lots of workarounds, aren't there, for these things that aren't necessarily surgery, and things that can help with these conditions.
Yeah, absolutely. Approaching it with the right mindset and with the right technique, I think, can make a world of difference.
Yeah. Good. Well, I'll shut it off there. Thank you.